The trapezius muscle teams up with the serratus anterior to accomplish upward rotation of the shoulders from 90 degrees to full lockout overhead. Note that there are three main portions: the upper, the middle, and the lower trapezius. The upper trapezius is frequently involved in headaches, while the lower trapezius is responsible for scapular stabilization. Rounded shoulder position from prolonged seated postures makes the trapezius overstretch and become less efficient and more apt to tissue compromise. Note that the trapezius spans from T12 all the way up to the base of the skull. This means that it features fiber directions that vary over 90 degrees. As such, it will need to be worked in several different ways. Keep in mind that the problem may not be exactly where the pain is. Many muscles refer pain in the area of the trapezius, including the infraspinatus, latissimus dorsi, and rhomboid, so you might need to check those out too. Trigger points in the trapezius vary based on which portion of the muscle has the adhesion. The upper trapezius is largely responsible for tension headaches. The middle trapezius refers pain locally between the shoulders, while the lower trapezius causes neck pain and pain in between the shoulders. The trapezius is the outermost muscle in the back, so you should attempt to feel around it yourself. Use a flat hand to feel the superficial tissue, looking for tender areas or changes in texture. Use the graph on page 15 so you know exactly what to feel for. A positive test will feature tenderness or pain with palpation, or you might even find an adhesion that matches the description on page 15. Let's learn to treat the upper fibers of the trapezius. Begin by loading a bar with 135 pounds at about shoulder height. Now slightly widen your feet and experiment with the appropriate height until the bar easily contacts the upper trapezius. With the bar firmly resting on the upper trapezius, move the neck laterally or to the side to stretch the tissue under the contact. If you're treating your left upper trapezius, stretch the neck all the way to the right. You can add additional tension here by rotating the head all the way away from the treated side. The upper fibers of the trapezius are commonly involved in headaches. However, this simple pin and stretch maneuver fails to treat the neck. For precise care of the neck, especially in repairing tissues after trauma or fixing headaches, I recommend finding a local active release techniques provider by going to activerelease.com and searching for a provider. Fibers of the trapezius span 90 degrees of different directions. Use this protocol for the middle and lower fibers. A soft mobility ball or a tennis ball is best for the middle and lower traps. Let's have a look. To target the middle trapezius, you should lay face up with the tennis ball between the shoulder blades and the spine. Add movement by laying the straight arm out flat to the side being treated. From this position, move the straight arm all the way across the body with the tennis ball contacting the adhesion. To target the lower trapezius, you should place the ball on the tissue located between the inferior angle of the shoulder blade and T12, especially close to the spine where the muscle fails. Add movement by laying the straight arm out flat to the side being treated with the elbow slightly closer to the body. From this position, move up and across the body towards the opposite shoulder. If the middle trapezius protocol moves the arm straight across the body at 0 degrees, and the lower trapezius protocol moves the arm up and across the body at say 60 degrees, then make sure you hit all those degrees in between those two, maybe 15, maybe 30 or 45. And this way you can get full treatment of that muscle. Hi, Dr. Nick here at MobilityWODShop.com. Click the link that just appeared on screen and you'll get a free lacrosse ball with any purchase above 30 bucks. Make sure you click that link now and your free lacrosse ball will be included with your next purchase. Do you want to have a deeper and more intense treatment of this muscle? Consider grabbing a MobilityWODShop massage gun. It works incredibly well for this area. Use code SUPERDEAL and save $200 on your purchase.